In order to discuss medical cannabis, we must first understand what it is and look at the possible benefits of medical cannabis as a possible alternative to our current medications. Fabio, you probably get these questions from your client base, and how do you respond to them? What do you tell them?
Thank you, Gord. This is such a hot topic in medicine these days. And as you mentioned, my background is in internal medicine and geriatric medicine. In particular, medical cannabis is finding incredible opportunities in the management and treatment of medical conditions in the geriatric population. We have certainly a long list of medications to treat all sorts of ailments and medical conditions in geriatrics. But medical cannabis is becoming more and more popular, and this is usually brought on by the sandwich generation, the kids of elderly patients who are bringing this to their parents and to the doctors that their parents are seeing. And so we get these questions all the time. Medical cannabis is doing its best to assume the status of a medication. And it's a very long process. The way medical cannabis is isolated and presented in products is very unconventional when we compare it to medical products in our industry. And therefore, there's a huge learning curve, and doctors today need to update themselves on in this topic. Many of them are undergoing other programs and educational sessions at their universities because they're not very well versed in this field. So it is an exciting time because the potential for medical cannabis is significant, I think, but it hasn't reached the level of a medical product yet.